All right, I'm back. So, like I said, I had that doctor who told me to get a hysterectomy, and I was like, yeah, whatever. But I want to say that the fibroids had gotten so bad that I saw the specialist, and she was like, yeah, you have some pretty big ones. I think you should look into getting a myomectomy. And so I was looking into it, and because of my job and everything, I had to plan it accordingly because I did a full open myomectomy, the abdominal one. It's like a C section, basically, scar, and you would be off for at least 6 weeks, right? And so I needed to make sure work wise, um, I had the time, I could take off the time, and I had things in place for that, right? So I wanted to be strategic about when I had my surgery, but at the same time, I needed to have it quickly because I was in pain. I was had to get on birth control pills because I was losing so much blood. My hemoglobin count was low, and I was losing so much blood. They said, "We're not gonna be able to do the surgery until your hemoglobin count is at a certain level," and I don't remember that number. I had to get on so I got on birth control pills. Didn't It was helping because my periods were lighter or whatever, or I think I didn't have periods, I don't remember. And by that time, though, my fibroids were pressing on my urethra, and it was painful to go to the bathroom. And it was really hard to go to the bathroom and to even walk to the bathroom. I ended up getting kidney stones from the fibroids. Had to go to the emergency. I was in so much pain. One dose of morphine wasn't enough. They had to give me two doses. I was in that much pain. And by that time, I had set a date for my surgery, September 2015, and I was going ahead. I think a day or maybe a couple days before my surgery, I got sick. I caught the flu, had to go to the hospital because I was having some pain and all that. I had a fever and all that. And they said, you know what? We're not able to do surgery if you have a fever. We got to reschedule for, I think, a week or 2 weeks. I was like, oh my goodness. Okay. So I'm like, oh goodness. So I rescheduled the surgery. And that time, like I said, I had the kidney stones. I ended up passing a kidney stone in that pain, but it was a lot. I had to drink a lot of water. Thankfully, the stone wasn't too big. I still have that stone actually somewhere. And so when I went for surgery, so September 2015, now the surgery, the open abdominal myomectomy, and I know they have like laparoscopic, I think, or some other type of more minimal invasive surgeries, and you do your own research. I think for me, even to this day, the open myomectomy, because my fibroids were so many and so big, it was the best thing to do. And so before the surgery, getting prepped for surgery, like I said, had to get on the birth control pills and things. They had, and I forgot the name of it. And if I remember, I'll put it in the chat. But they had these two syringes. It was optional. It was optional. However, they said if you get these two syringes put on your sides or something in your muscle tissue, then your recovery, it won't be as painful. It'll be quicker recovery and things of that nature. Glutton for pain, I did it right. It was painful, but I think it maybe helped because afterwards the recovery wasn't as bad. I also had to they give you a big needle in your hand. And I asked the anesthesiologist, who the team was amazing, who worked on me. And I asked the anesthesiologist, he said, well, we give you a huge needle in case you need a blood transfusion, you need blood. During the surgery, we want to make sure we pump it in really fast if you lose too much blood. I said, okay, that makes sense, right? My mom came with me at with the surgery, and she was there. Now, the surgery was supposed to be 2 to 3 hours. Mine was 5 hours. So, of course, my mom was frantic and worried. And of course, I didn't know what was going on. You know, you take the anesthesia, count back, what, five or maybe three, you go to sleep, wake up. It's like, oh, it's over. Not knowing it's been 5 hours later. And the scary part is during my surgery, they caught a cold blue. And my mom was worried because she's thinking I should be done. And I'm hoping they're updating her. I don't know. I don't remember if they updated her or not. But what I do know is unfortunately someone else had lost their life that was on this having surgery around the same time as me. And I felt really bad because in the recovery room, I guess we were all in the recovery room, and I remember his family crying, and I was just very, just kind of solemn about that. But for my surgery, so what they ended up telling me, my surgery was so long, I lost a lot of blood. I had to get 2 pints of blood. So I did have a blood transfusion. I had to get 2 pints of blood while I was underneath, while they were operating. And then I had to get two more pints of blood. I stayed in the hospital for 5 days after my myomectomy. And what they said is that it was so difficult to tell your fibroid. I had one large fibroid that looked like my uterus, and they almost took out my uterus. Thankfully, everything sort of worked a line, and I'm a Christian, so as a woman of faith and prayer, I thank God that my surgery had to get rescheduled because at that time it was a specialist there, a male doctor specialist, and that was his specialty, working with fibroids. He finished up my surgery. He came to see me. He was so amazing and great, and he told me, he was like, "Don't worry, because I know you look like you're worrying about it." He said it was tough, and my doctor, she told me in advance, I want to be careful. I'm always going to err on the side of caution. So if I have to leave some fibroids in, I'm gonna leave them in because I want to make sure you're safe. Your safety is my ultimate concern. So she didn't. She went to go get him. And I'm glad her pride didn't get in the way. And she went to go get him. And he finished up my surgery. He said it was hard from the x-rays to determine your uterus from the fibroid because of how it looked, but he got it. He said, he told me, because I was worried, of course, about am I going to be able to have kids now? Like, what does that mean? And he said, don't worry, and send me a picture when you have your future child, right? This was in 2015. And so that recovery process and everything, the follow-up, and I'll probably end this here and then get into my pregnancy journey. But that follow-up afterwards, when I went to go see my doctor, she said 2015, she said, "Make sure, try to have your baby within the next 5 years if you wanna get pregnant, because I didn't take all your fibroids out, they could grow back, and you could have pregnancy complications." And also, one of a result of this surgery is that sometimes, depending on the intensity of the surgery, you could have scar tissue on your fallopian tube. And that could affect your pregnancy as well. So, of course, all this is running through my mind. And at the same time, I have what the other specialist said, send me a picture of your firstborn when you have him, right? Or have him or her. I don't know if he said him because I had a boy. And so at that time, that was 2015. Mind you, I had my baby in 2023, right? Almost 10 years later. But I'm grateful and thankful that she was careful and cautious. And it did help so much. Like if you're determining whether if you have fibroids, and I know surgery is big, so I understand. But if you're trying to figure out if you want to have surgery, a myomectomy, check what's best for you and determine, which procedure is going to be better. But one, they used the same, and moving ahead to my pregnancy, they used the same scar from my surgery, my myomectomy, to deliver my baby because I had to have a C-section. So, they didn't have to cut me somewhere else. But I also wanna say it just changed my way of life. I had so much energy afterwards. I, of course, lost weight, had so much energy, and it just been helpful. And my fibroids, I still have fibroids, but they are not as big, so they don't give me as much pain. They don't give me any pain, actually. My periods might still be a little heavy, but they don't give me as much pain as they did when before the surgery. So if you're wondering, determine it is big. Surgery is big. Make sure you have the support afterwards, that someone's gonna be there and help you, because it is a little rough, and I can give you some tips about that if you are about to have surgery, some things to keep in mind for myomectomy. Just let me know, and I can do a quick video on that. But I'm gonna move into my pregnancy journey and video next. So I hope this was helpful. I hope you enjoyed just listening, and I just want to share my story to just make sure maybe I can help someone else lighten the load. All right, see you in the next video.